All right. Hey, everybody. Welcome and thanks for coming to my talk on cancer recovery and mental health. My name is Dean Charles. I'm a licensed psychologist here in the metro area. I work for a company called Mental Health Systems. We are um, uh, we're a mental health clinic, obviously, but we specialize in dialectical behavior therapy, or DBT, as some people might know it as. We also been branching out into some more integrated behavioral health programming. So we're branching out into treatment programs for people with chronic pain and co-occurring mental health conditions, and we've started recently a cancer and mental health program as well. As a part of that, we've been working with some local agencies like the Angel Foundation and Gilda's Club. And so that's kind of our foray into this field. Um, uh, I'll really just end it there because I'm assuming that nobody came to this to hear more about me. So I have included in the PowerPoint slides my personal business information, my email, my phone number. So if anybody has any more specific questions kind of for me or about any of the stuff that we do at Mental Health Systems, I'm more than happy to answer any of those questions. But for the sake of our own time and energy, I will stop talking about that and get to the reason why we're all here. Um, so to start us off, to go into what the issue is, as I'm sure some of you have or maybe the majority of you have my PowerPoint slides in front of you. I have a bunch of stats on there about the percentages of people that have mental health conditions and cancer, and how those conditions stick around after treatment for many people. To really just summarize the stats, since again, I don't think anyone came here to hear stats. The real issue is that people with cancer often have mental health and emotional concerns. And frankly, not enough people get help for that or address them. And that's really what the statistics show, is that it's common for people with cancer and people in cancer treatment and people in remission to have kind of this co-occurring mental health or emotional concern. And for many people, there's a hesitancy to reach out and get help for it or to address it specifically. As we kind of move on, we'll look at the mind-body connection as a potential explanation as to why that is. I'm going to talk about, for the sake of this training, you'll hear me talk about the mind-body connection. I'm going to take us on a slight tangent and stand on my own little soapbox for just a moment here and kind of push back on that terminology, even though I'm going to use it. So the mind-body connection is kind of this weird thing that we talk about, and I'm sure many people have heard about it, that your mind and your body are somehow connected by this pathway, right? That things happen in my body, and so they impact my mind, and things happen in my mind, they impact my body. And to a degree, that's really useful, like I said. But in another sense, it's kind of this false separation still, that we don't actually have a mind and a body, and somehow they're connected. Really, more accurately, what we have is a person, like I am me. I have a mind in my body and a body, but they're really the same thing. And and if we think about it more like that, that my mind and body are one and the same, and they're not actually separate, even though when we talk about them, it's easier to separate them. If I think about it like that, it ends up making a lot more sense that that as things happen to me medically, as things happen to me physically, they have an impact on my mind, on my emotions, and vice versa, right? As I have distress or as I have anxiety, depression, things like that, that it would also have an impact on my body. We really can't have an experience in our body or our mind and not have it impact the other. There's a lot of really interesting research in the integrated behavioral health that even show things like when people go in for surgeries, even just having like a single mental health appointment with a mental health professional to address some of the stress and the concerns, can help with things like recovery time, can reduce the amount of medications people need. And so for us, in the way that we think about things, it's often really useful to just remember that the mind and the body both need to be attended to. And oftentimes people will think that if they have a physical issue, they need to do physical treatment. Or if I have a mental issue, I need to do mental treatment. And more our understanding is expanding to understand that we actually need both for both for many situations. When we think about what some of the common co-occurring concerns or issues are that arise both when we have cancer and through cancer treatment, we notice some common themes. So some of the common co-occurring issues are things like the long-lasting impact that cancer and cancer treatment can have on our bodies. Things like physical changes can have an impact on functioning long after cancer goes into remission or long after the cancer treatment has ended. Things like pain and pain sensitivity, things like energy, all are things that can linger. We also notice things like changes in social and interpersonal relationships. What I mean by that is things like social roles, the role that I might have had in my family or in my friend groups before I had cancer may have changed once I got a cancer diagnosis and subsequently through treatment. Now that I'm in remission, what's my new role? Do things go back to normal or they changed? Not that there's like a singular answer for that, but acknowledging that those changes in our social relationships also continue to have impacts on us after the treatment for cancer has ended. And then finally, things like cognitive issues. And what I mean by that, just the way that our brains work. We can have ongoing issues with things like processing speed, meaning when I receive or when I get information, how fast can I understand what that information means and then respond to it? Other issues related to other cognitive issues related to cancer treatment involve things like planning, planning things maybe 2 or 3 steps in advance, and then also difficulty with memory. Those are all some of the cognitive concerns or cognitive issues that can last, like I said, long after treatment has ended and cause some ongoing struggles for us. When we connect those things to maybe more specific mental health concerns, some of the common things that we see are things like depression, what this might look like, and this is just an example, things like fatigue, having low motivation, changes in appetite and sleep, reduced satisfaction or pleasure in activities, feelings of loneliness and isolation. That's kind of the common way that you'll see depression kind of rise to the surface, if you will. You might also see this coming out as irritation. Things like irritation, anger, maybe having a shorter fuse than traditional or than normal. Or all kind of an alternative way that you might see depression pop up. We also notice increases in anxiety or having anxiety as being a common co-occurring mental health condition for people after cancer. I'm sure a lot of people just generally know what anxiety looks like, but feelings of nervousness or being edgy, you might notice issues in your body, holding more muscle tension, feeling more of a sense of panic or shortness of breath at times, feeling overwhelmed, having some more struggles managing your thinking or ruminating about things. You'll also see this play out specifically in like health anxiety, being really concerned about new symptoms, whether they be cancer related or not. New kind of health or physical ailments that pop up may result in a much higher anxiety response than before. or even when you're experiencing symptoms that maybe reminded you of a cancer diagnosis, when there's similarities to the way that you feel, can also bring up a more intense anxiety response than maybe you would expect. As we move on, kind of the last one that I'm going to touch on here is the co-occurrence of trauma or grief. What this would look like, or an example of what this might look like, would be just increased vigilance, being more on the lookout, possibly for the health symptoms or the medical symptoms, but really just being more vigilant. Maybe you're re-experiencing some of the events related to cancer, more nightmares possibly. You would also just see this as avoidance of situations that might remind you of cancer or cancer treatment, possibly avoiding things like medical appointments or certain conversations or topics. You might also see things like self-destructive behaviors. You might see an increase of substance use or other risky behaviors. A lot of times this would play out in some way, shape, or form. You'd see this connected to things like survivor's guilt. You would also see big reactions to like pain possibly, or like I was saying before, things like medical tests might also bring about a lot of traumatic memories or thoughts. The one thing that I want to say, or one of the things that I want to say on this, is that I hope everyone hearing this can hear my descriptions of things like depression, anxiety, trauma, and I hope everyone can see or validate how those things make a ton of sense, and that I'm not bringing any of this stuff up to send the message that somehow means something is wrong. I think it makes a ton of sense when you look at the intensity of what a cancer diagnosis means and the extent to which cancer treatment impacts us in our lives and the lives of the people around us. It makes a ton of sense to have big emotional reactions. It makes sense to struggle with these things as time goes on. And again, going back to this idea of the mind body being the same thing, that if they're not things that we specifically address through the course of our treatment, you could see how they would linger after the treatment's done. Yeah, I think I'll stop it there just for the sake of our own like time and attention. But I hope everyone can hear that and acknowledge that that makes some sense, and that if they weren't really addressed during treatment, it would make sense to address them once some of the physical symptoms have subsided, or as other treatment has ended. It would make sense for them to stick around and to deserve a little bit of attention now. I also want to point out, I gave some real general descriptions of things like depression, anxiety, trauma. There are other ways that those things can manifest or be expressed. I touched on real briefly the way that depression can be expressed as anger or frustration. That's one. There are others too. I'm just giving you all this like general idea. There are also a lot of different things, different emotional and mental concerns or issues that might pop up. And so the idea kind of being is I'm giving you this real basic information. And at the same time, if what you're experiencing maybe doesn't fit in the exact boxes that I'm saying, that would make sense too. And if you're having concerns about that, as you go see someone who's more trained in identifying some of these mental health concerns, they can actually help navigate those waters in terms of if you're not fitting neatly into a box, but still think you might want some attention paid to some of these concerns. That's kind of what people like me are here for. I'm going to talk a little bit about protective factors. These are things that exist, or things that people might have as a part of their lives that might reduce the impact of some of these emotional concerns, or might decrease the interference. And so some of the protective factors that we notice, first and foremost, is just having a positive social support. The first level of that are our family and friends, right? Having a social support group close to you that you can talk to, but also acknowledging that that's not necessarily everyone's situation, that not everyone feels entirely comfortable talking to their family and friends about all their emotional issues. Maybe you have a social group that's not necessarily open or understanding of those things. And so when we look at different ways that we could expand that positive social support, really the next level would be things like support groups. Essentially being not necessarily therapy, but getting connected to a group of people that that can understand what you're going through, that can provide validation, that can provide support and understanding. Not necessarily focusing on changing much, not necessarily focusing on like treatment, like I said, but really just there to provide the validation support that a lot of people need. Another protective factor that we notice that can help reduce the impact of some of those mental emotional concerns would be having a collaborative and positive relationship with your healthcare team. Having a healthcare team that you can talk to, having a healthcare team that is there to listen to your concerns and answer questions. And really, when I say a healthcare team, I mean a more complete or maybe a more extensive team than just like your primary care physician or your oncologist, which would be a part of it, but also considering different members of a potential healthcare team, whether that be nurses or maybe a psychologist, a psychiatrist, heck, even a pharmacist, really making sure that that healthcare or treatment team is extensive and supportive. Kind of connected to that is also this idea of having accurate information. I don't know if any of you are like me, but when left to my own devices, I can get a small piece of information and I can just roll with it, right? I can just let it spin. I can start going into worst case scenarios. I can start coming to my own conclusions on things, which, if I'm being completely honest with everyone, are not always completely accurate. And so the idea here being part of it being doing your own research and doing complete research, but also connected to that collaborative and supportive healthcare team, making sure that you can check out information that you get with your healthcare professionals so that they can help you also come to maybe more accurate conclusions than we would come to if just left to our own devices. And then finally, and I'll talk more about this in a little bit, but finally, engaging in self-care. Making sure that we are taking care of our minds and our bodies. I mean a lot of things by this. The idea of self-care is really, really broad. That's everything from making sure that you are eating as healthy as you can, that you're sleeping as well as you can, that you're moving when you can, but also things like connecting to positive social support, using relaxation, doing whatever the activities may be for you specifically to care for yourself and to care for your body and your mind. And by all means, if anybody has any additional ideas, I only gave like 4 ideas. So if anybody has any additional ideas or suggestions as to what you do for self-care, go ahead and throw them in the chat here. So I've kind of talked about so far what the issue is. I've talked about maybe why or some of the overarching reasons why that issue exists. I've talked about some of the protective factors. I haven't given you much that you can do though. And I would like to switch gears and to talk a little bit about what are these things that you can do. I touched on them a little bit with protective factors, but when it comes to being in a situation where you may be in recovery and you're still noticing some of the mental and emotional issues kind of lingering, which, like I said, makes a ton of sense. What are some of the things that you can do to respond to those or respond to that? First and foremost, kind of one of the foundational things that you're doing is you're keeping up with aftercare. Keeping up with any kind of aftercare for medical issues and making sure that you're attending any follow-up appointments, making sure that you're following recommendations, making sure that those maybe smaller medical issues aren't getting swept under the rug. Reaching out to professionals when needed. And by professionals, I mean both your primary care physician, any medical professionals you have as a part of your treatment team, but also making sure that you know when maybe an appropriate time to reach out to a mental health professional. Which, if anyone has questions on that, by all means, I can answer some of those questions. But essentially, you're looking at the impact on functioning when you're noticing your mental or emotional concerns getting to the point where you can't do the things that you want. It's probably time to reach out to someone. Or if you've tried to manage them on your own and it hasn't been particularly effective, that's a good time to start reaching out to someone else that can give you maybe some different feedback or some other help. Making sure that you're staying connected to positive social support. Again, I think this can be a tough one because for a lot of us, especially in the time of COVID and quarantines and isolation, it's tougher to connect with social support, and sometimes that phone can feel real heavy to reach out or to text or to Zoom, and sometimes we can say, well, it's not exactly what I want, so it's not worth it. But finding ways to stay connected to the positive social support that we have as a part of our lives, and doing so even when it feels difficult, even if we can't do much, making sure that we're still staying connected to people. There's this idea that we too often think of self-care, and I'm going to talk about self-care again in a second here, but we too often think about self-care as just eating right or moving. But really a big part of self-care is also staying connected to the people that support us. That self-care is not just an isolated thing that I do on my own, but it's something that I bring the people that are close to me in on, and that we can help each other maintain our self-care. And then the last thing that I have on this, what can you do? We can continue to build on our physical, mental, and emotional coping skills. We all have the things that we do. We all have the things that we're accustomed to doing when we feel sad or anxious. We have our go-to things that we do. As you may have discovered, and as I've discovered in my life, those things don't work in every situation. And so making sure that we're continuing to learn, continuing to expand on the different ways that we can cope with our emotions. And sometimes what that means is trying things that we don't necessarily think will work. Some of the examples that I have in the handout are things like using specific relaxation skills, using things like mindfulness, yoga, other kinds of self-care things. I'm not sure if anybody in here has the same reaction as I do on some of those, but sometimes when I get exposed to new relaxation techniques or new mindfulness techniques, I just think they're silly. And I think I'm going to feel all self-conscious. But when it comes down to it, when I actually try them, I end up feeling relaxed or end up feeling just a little bit better. And so the idea when I'm talking about like building on physical, mental, and emotional coping, it's even opening ourselves up to trying some of these things that we might think are a little dumb. Not to put too fine a point on it, but giving different things a shot, seeing what works, seeing what doesn't work, and then kind of curating our different coping skills so that if the first things that we try when we're feeling overwhelmed or sad or anxious, if the first things that we try don't necessarily give us what we want, can I move on to something else too? Hopefully that makes sense for people. So those things that we can do if you decide to go more formal. There are different treatment options that you have as well to deal with different mental health concerns. Probably the most common thing that people do is individual therapy. You'll see that what I have in the handout, just a couple of the common kind of specific orientations that you'll see out there. I won't go really deep into them, but those are probably the two of the more common ones: cognitive behavioral therapy and some sort of mindfulness-based treatments for your individual therapist. Each therapist will have their own orientation that they work from, and each person kind of has different orientations that they connect well with. And so I just gave two common ones, but there are many, many more out there. And so it would be maybe just an interesting thing to ask as you're looking into individual therapy, asking clinicians what their orientation is and how they work on different issues, and then seeing if that connects with how you want to work on them. Moving on, family therapy is also an option for a lot of people. What this would be is essentially just not focusing on the individual per se, but focusing more on the family system as a whole. This can be really useful when looking at, like I said at the beginning of the presentation, as like social roles change, as roles in the family or the system have changed, this might be really useful to getting things back on track and to developing kind of new norms. Kind of some other things like support groups are pretty useful. Sometimes these support groups are more formal than others. Sometimes they're really casual. Sometimes you'll find support groups led by mental health professionals, but oftentimes you won't. And so looking into different options for those, and I do have a link at the end in a slide coming up where you can find different support groups too, if that's something you're interested in. And then finally, I have just medication. Medications for mental health concerns are really useful for a lot of people, and can definitely be something that you work on with either your primary care or a psychiatrist, if that's the route that you choose to go. I'm just about ready to wrap up here. I just really have one last message on the last slide. Is essentially just acknowledging that for a lot of people, as a kind of complete treatment, as people look ahead to kind of redeveloping or resuming their life, if you will, that the expectations of returning to a life that is the same as before cancer really might be unrealistic. That kind of developing new norms for your life involves a lot of living with uncertainty, and learning ways to just deal with or to cope with that kind of consistent uncertainty is a real challenge for a lot of people. That switching our focus to doing more and more of the things that help us exert our influence as opposed to our control in our lives is going to be a useful thing to try, and something that when we talk about kind of these chronic health concerns at our programs at MHS, we talk a lot about this idea of influence versus control, and what can I do or what skills can I use to exert more influence, and how I can use my influence to feel more of the way that I want to feel. As I try to control more and more things, what people often find is it just doesn't help them feel better. And so I'll kind of cut it short there, but there's probably a bigger lecture, bigger topic in there too. But essentially my point here being that establishing these new norms can take time, they can take support. And so really working on, for us as all individuals as we go through this, being gentle with ourselves, being compassionate with ourselves, and acknowledging that this development can really be a moving target. And for us to have the compassion with ourselves to allow that target to move and to adapt as we go is really important. What I've included kind of on the last couple of slides that you'll see, I have a couple of just links. If people are interested at all, I have a link to the Angel Foundation and to Gilda's Club. And then the last one is for the Cancer Survivors Network, which can help find things like support groups. And then I have some resources on the last slide too, if you would like to kind of look up any of the things that I've been talking about today. I believe that's all I've got, and you should be able to connect with me live here, I think right about now, to ask any questions, and hopefully I can answer them. All right, thank you very much for listening to me. I appreciate it, and I hope you found it helpful.